A facility in your district just reported that a child was hospitalized from a severe reaction following a vaccination. As a district or subnational manager, it is important to know when and how to investigate these cases of adverse events following vaccination, or AEFIs. If the case is not investigated, a potential problem could be missed, and you could lose the trust of communities in your district. AEFIs may be caused by an immunization error or a problem with the vaccine itself. An investigation can help you identify these problems so that they can be addressed and further AEFIs prevented. But many AEFIs are unrelated to vaccination. An investigation is still required in these cases to ease the public's concerns and maintain their confidence in the immunization program. Keep in mind that who conducts an AEFI investigation may depend on your program, the nature of the AEFI, and the expertise available. When the cause of an AEFI is clear, an investigation by district managers may be sufficient. Otherwise, investigation should be done by trained staff at a higher level. As a subnational or district manager, you will need to support the investigation however appropriate. In this video, we will review the steps for conducting an AEFI investigation. Confirm the AEFI diagnosis, collect data on the case, assess the immunization services, formulate a hypothesis about the cause of the AEFI, and report your findings. During your investigation, record all of your findings in a standard WHO AEFI investigation form as adapted by your country. When you receive a report of an AEFI, first confirm the diagnosis and severity of the case. Verify the information in the AEFI report. Check the medical file to confirm details about the patient and the event. Once you confirm the diagnosis, determine whether the AEFI requires a detailed investigation. A reported AEFI should be investigated if it appears to be a serious event, one that results in death, hospitalization, persistent or significant disability or incapacity, or is a congenital anomaly or birth defect. An AEFI should also be reported if it belongs to a cluster of AEFI or two or more cases of the same adverse event related in time, place, or vaccine administered, is a previously unrecognized event associated with an old or newly introduced vaccine, involves an increased number or rates of known cause, is a suspected immunization error, appears on the list of events defined for AEFI surveillance, and if it causes significant parental or public concern. If an investigation is needed, it should be initiated as soon as possible, ideally within 24 to 48 hours of the first AEFI report. Next, collect more data about the patient, the event, the suspected vaccines, and other people. This data should be collected in person by a supervisor or other trained staff member. Use available records to gather the patient's immunization and previous medical history. This would include prior history of similar reactions, allergies, and any family history. Collect details on the event itself, including a clinical description of the AEFI, any laboratory results, diagnosis, treatment, whether hospitalized, and outcome. Collect data about the vaccine or vaccines administered. How was the vaccine shipped and stored? What was the state of the VVM and temperature record of refrigerator? And how was the vaccine reconstituted, if applicable? Note the date of manufacture and lot and batch numbers of vaccine and diluent. Finally, Collect information about other people. Did others who received the same vaccine have similar reactions? Are unimmunized people experiencing the same reaction? This will help you confirm whether the case was isolated or part of a cluster. If other beneficiaries developed a similar reaction to the vaccine, they may need to be included in the investigation. Next, assess immunization practices of healthcare workers. Review immunization practices at the site. Is the cold chain adequately maintained when vaccines and diluents are distributed and stored? Are vaccines reconstituted with the right diluent? Are sterilized syringes and needles used? How are health workers trained and supervised? Also, observe health workers preparing and administering the vaccine. Observe whether they use the correct technique, administer at the appropriate site, use the adequate diluent, and safely dispose of the vaccine. Next, formulate a hypothesis about the most likely cause of the AEFI. The possible causes of an AEFI are grouped into 5 categories. The event may be related to the properties of the vaccine product itself, a quality defect of the vaccine product or the administration device, an immunization error caused by inappropriate handling, prescribing, or administration of the vaccine, and anxiety of the infant or parent about the immunization. It could also be a coincidental event that is not actually caused by the vaccine. The event may have been falsely attributed to the vaccine through a chance association with another infection or illness. You may be asked to test your hypothesis based on other cases and lab results. Finally, report your findings to the next higher level. Complete the AEFI investigation form and share with state or national AEFI committee. This committee may determine if a further causal assessment is needed. If your investigation identified any problems in your immunization program, take corrective action immediately. You now know how to conduct an AEFI investigation.